Changing toothbrush regularly is crucial to maintaining oral health. It is advised to replace your toothbrush every 2 to 3 months. Over time, the bristles on your toothbrush can become frayed and less effective at cleaning your teeth and gums. Additionally, bacteria and germs can accumulate between the bristles, posing a risk to your oral health. Consider this: every time you brush your teeth, your toothbrush is exposed to not just the bacteria from your mouth, but also the environment in which it is stored. Bathrooms, albeit convenient, can often be humid environments where germs thrive. If left unchanged, this can contribute to oral infections or other dental concerns. Moreover, frequent replacement of your toothbrush helps you maintain good dental hygiene habits. Often, a new toothbrush can act as a prompt to reassess brushing techniques or to take notice of the start of any dental issues. New toothbrushes are more effective at removing plaque and food particles, helping to maintain fresh breath and overall dental health. For those using electric toothbrushes, it is equally important to change the brush heads with the same regular frequency as traditional manual toothbrushes. Remember also to store your toothbrush in a dry, upright position and away from other brushes to minimize cross-contamination. Ultimately, a simple step like regularly changing your toothbrush can go a long way in preserving your smile and preventing tooth decay or gum disease. Always look out for signs indicating that a toothbrush is past its prime, such as worn bristles or an unusual odor, and make it a point to replace it consistently.